Are you suffering from pain that just won't go away? You get it from headaches, maybe arthritis, or even fibromyalgia. It seems like you no longer have control over your life, and it's hard to maintain an active lifestyle. Now, your current medications may help you temporarily, but the pain keeps coming back. Donna Murray knows all about this experience, and also with her today is board-certified cardiologist Dr. William Schell, who will give some insight on the risks of commonly prescribed pain medications and how to improve the underlying cause of persistent chronic pain. Good morning, doctor.
Good morning.
Thank you for being here, Donna.
Hi, good morning.
You as well. Donna, let me start with you. Tell me about what you have suffered and how has it affected your life?
Over the past 10 years, I've had 2 total hip replacements.
Oof.
I've had my gallbladder done. My knee bothers me occasionally, but what really bothers me now is I have suffered from chronic migraines. And I have taken over-the-counter medications, prescribed medications, ice, anything that I can do just to make the pain go away.
And it doesn't.
It doesn't. It keeps coming back.
And you know, doctor, I have to tell you, she sounds like my dad. My dad has taken, like she said, over-the-counter medications. I have filled some of his prescriptions at the pharmacy. And he always tells me the same thing, honey, I'm just in so much pain and I want it to go away. Why are they so ineffective, if you will?
It's becoming an enormous problem in the United States. I think last week it was announced that there are more deaths now from prescribed medication than there are for auto accidents.
Really?
And most of those deaths are related to pain medication. Because of the side effects associated with the over-the-counter preparations, there's more and more use of narcotics by physicians that leads to addiction, tolerance, further attenuation of the responses, more medicine, more side effects.
And what are some of those side effects, doctor?
Death, gastrointestinal hemorrhage, heart attacks, high blood pressure, congestive heart failure.
My goodness. So how does one, like my father, Donna, and so many others out there, what do they do to help manage that pain that would be a little bit more effective and healthier?
Well, there are now these products called medical foods, which are regulated by the FDA as if
medical foods?
Yes, they're regulated by the FDA as if they were drugs, and so that they have the same testing requirement, but they don't require pre-approval. And they manage the nutritional deficiency associated with chronic pain. And chronic pain patients simply can't absorb enough of the nutrients required to sustain their blood levels. Therefore, if you begin to treat those nutritional deficiencies, you can manage the pain either with the medical foods as standalones or with a reduction of the dose of the commonly used pain medications.
And I have to be honest, doctor, this is the first time I've heard of medical foods. How would I know in terms of what to get that would be more effective for me?
Medical foods have to be supervised by physicians.
Okay.
They are not over-the-counter preparations. And so you have to consult with the physician who knows something about it, and therefore you can get this nutrient supervised systems for managing chronic pain.
Is there one that kind of like you feel has been very beneficial for some of your patients?
We have access to a product called Theramine.
Theramine.
Yes, which in fact has the precursors to the chemicals in the brain that suppress pain. And so if you can keep those at an appropriate level, the pain syndromes really come under control, and they don't cause hypertension, and they don't cause heart attacks or congestive heart failure.
And in the end, help that patient not feel that pain again.
Well, it keeps it from coming back.
Oh, that's awesome.
And it does it without making you groggy. People who take chronic pain medications, you get groggy and you lose memory.
Right.
And when you replace the nutrient deficiencies, none of that happens.
Well, let me tell you, it's something that I'm going to look into for my father because he needs it. And Donna, I hope you do too, and I hope you feel a lot better. Thank you, doctor. Thank you for the insight. Really appreciate your time. Hope you get better. And if you'd like to know more about conquering your chronic pain with medical foods, go to the website. It's PTL, that's PTLcentral.com. Something interesting because I've never